Today we're going to talk about insulin resistance and 3 supplements to maybe avoid and 2 to take a closer look at. When we talk about conditions like insulin resistance, it's really easy to get caught up in the latest fad or the newest TikTok about a certain supplement. But as I tell my clients, not all supplements are created equal, and some of them that are touted as helpful can actually hinder. Insulin resistance is actually where your cells become a little bit stubborn, not responding as efficiently to insulin. And that means your pancreas has to work overtime, pumping out more and more insulin just to keep your blood sugar levels in check. So if this goes unchecked, it can pave the way for prediabetes and even type 2 diabetes. And of course, factors like genetics, age, weight, all that kind of stuff, that all plays a role in its development. And that's where we get to supplements and people wanting to use supplements. And there are 3 that are popular right now that maybe you should consider not using, and 2 that deserve a closer look. So let's look at the 3 supplements maybe to avoid. So St. John's wort, very popular herb for mood support, even menopause symptoms, but it can interact with certain medications, including those for diabetes like metformin. And those interactions could potentially reduce the effectiveness of your diabetes medication, which would lead to higher blood sugar levels. Not what you want to have happen. Then we have Genema. This has really gained popularity because it causes sweet things to taste not so sweet. And so it's thought to shut down your sugar cravings. However, there's a real risk of low blood sugar, hypoglycemia, when taking this herb. Then we get to BCAAs. Often taken by those looking to build muscle, they are protein building blocks. However, we have research coming out that is showing a link between BCAA supplementation and worsening of insulin resistance. Now let's look at 2 herbs that deserve a closer look. First up is ginger, and ginger has been shown to reduce blood sugar levels and increase insulin sensitivity. It's also known for its anti-inflammatory and antioxidant properties, which are always a plus when supporting overall metabolic health. Next up is hibiscus. With its vibrant color and tart taste, hibiscus is also excellent at reducing blood sugar levels and increasing your insulin sensitivity. In addition, it also supports healthy blood pressure and cholesterol, and those are also important aspects of overall metabolic health. There's also some easy lifestyle changes that you can make, such as eating more protein-rich foods. Protein helps you feel full and satisfied, and that helps you with natural weight management. You can load up on veggies. Non-starchy veggies are packed with fiber, they're low on carbohydrates, and it slows down sugar absorption. Regular physical activity, even if it's just 20 minutes a day, is very powerful. Exercise prompts your muscles to use blood sugar more efficiently and makes your cells more sensitive to insulin. And of course, focus on a healthy weight. Even modest weight loss can make a significant difference in improving insulin resistance. My biggest takeaway is this: it can be really tempting to look for a quick fix or the next popular supplement to take, especially when you're dealing with a chronic condition that is a little tricky. But my suggestion is go for some modest lifestyle changes, work with your doctor. And yes, there are herbs and supplements that you can take, but just be very judicious about it and understand that you have to take in the full health picture.